Hi, welcome back. You're probably wondering how the library fits into how do you know what to do at the clinical site? So now we're going to do some exploring. Years ago in the 1980s, a major nursing study was done in Canada with 18,000 participants, all nurses, practicing nurses who had an average of 18 years in the field. And these nurses were asked how they make decisions at a patient's bedside on care. So there were choices of about 16 or 17 items, and they were to rank them on what had priority when you were making decisions for an ill patient. So, the first one, in fact, the first six, the top six that the nurses chose as being the points that helped them make decisions on care were observation of the patient, which is common sense, personal experience. Third was lessons from nursing school, which that was impressive after 18 years out of school. Some of a major portion of the participants had, and conference and in-service workshops, which that's also reassuring because those are updated care, kind of keeping you on the cutting edge of how things would need to be done, as well as policy and procedure manuals that hospitals or healthcare facilities have, so that people follow specific procedure. And fellow nurses, most of us in all of our vocations tend to grab the expertise of the people around us in the same field. And I'm sorry, that was the chat going off. So let me go next to what the last 3 points that or areas that nurses used out of the 16 or 17 choices was, excuse me 1 second. Okay, I had to take care of that chat. Anyway, the last 3 choices that came in, third to last was medical journals, and those traditionally were geared more toward physicians. So nurses at bedsides or on the floors were not making decisions by, reading through physicians' journals. However, nursing journals, which are specific studies geared toward nursing practice, came into second to last. So that's one of the reasons that we're here, and I'll explain that further. Last choice was popular magazines, and I always tell students we're glad of this because we don't want Uncle Paul treated with Field and Stream. But anyhow, but the nursing journals are what we're going to focus on. Okay, so what this revealed, this study was indicative of the whole nursing field, that people were doing, or not people, nurses on the floor in the hospitals or in the doctor's offices were doing things, practicing the way things were always done, but not necessarily looking at the research for new information. And today there seems there it's indicated that there's still a gap. So this started back in the 80s, and now we're still trying to close that gap between um, doing things the way that we know them rather than updating and being aware of the latest credible research. So that's how we came to evidence-based practice. So that's a framework for clinical practice. So when you're active with your patients, that incorporates the best available scientific evidence, which comes from the journals and the studies that that the library can provide you with, and databases, and with the expertise of the clinician, that's you and your training, and the patient's preferences. So that threefold model is what evidence-based practice is. And that is something that is a component of nursing now. And that research component has come to nursing a little later, or is considered the gap. So that's why we're talking today. The other thing that we wanted you to know is evidence-based practice or research comes at various levels of credibility. So if you look at this pyramid, it's considered the evidence-based pyramid. And you'll see at the bottom, the widest part of the pyramid, there are various studies. That doesn't mean that they lack credibility completely. For example, you have an expert opinion. Maybe there's a doctor at Johns Hopkins who's been a forerunner and done thousands and thousands of prostate cancer surgeries, and he, does puts out an article. There is valid information there. However, as you go up the study pyramid, you can see that the studies they become less, but they actually become higher in quality. And you don't have to memorize this. You just have to be aware when you're looking at nursing studies to look at the methodology. How was this study done? What type of study was it? Was it original research, or was it bringing together at the very, very tip a lot of different information and vast studies that shows, even more credibility?